any sort of strategy apart from the simple things which Dr. Roy Chowdhury mentioned of masking and hand washing, and Vikram, you mentioned this almost as way back in May of 2020 when we first did the session. But is there any strategy in your hospitals, amongst the doctors, amongst the front line, how to sort of battle this new issue that we are facing? I won't call it a wave yet, and Niharika has asked this question, so can we look at trying to answer that?
I can take the first stab at it, and Dr. Roy Chowdhury. So I completely agree that it's been a very difficult year for all of us, and it's just human nature that we need to get together with our friends and close family, stop wearing masks. Many of us are compelled to go back to work, and it's been a long year. I would just reinforce that the hand washing that Dr. Roy Chowdhury mentions, the mask, sometimes a double mask, social distancing as much as possible, should still be part of our daily lives, at least for most months of this year, till we have better control. It's easy to forget that this is still out there. It's still killing thousands of people across the globe, thousands of people in the US every day. And though it's been a long year, I don't think this is the time to stop our infection control practices.
And Dr. Roy Chowdhury did mention about the economic side of things where people had to get on with their lives. But Dr. Roy Chowdhury, apart from the simple things of that you mentioned, wearing a mask and keeping your hands clean, sanitizing, are there any other basic infection control measures that doctors such as you would advise those of us who are listening in today?
Yeah, basically keeping prevention is always better than cure. And I think keeping things simple always helps, especially people who are above the age of 60 or have comorbidities and illnesses, like diabetes, hypertension, etc. It's just not COVID. There are other things out there that kill more than that. So if you have COPD and you have diabetes and hypertension, make sure you're vaccinated against the other things that happen much more commonly, like the pneumonia. Take your pneumonia vaccine if you are eligible for it, and your yearly influenza shot, which actually will help you a little bit. And keep your nutrition well. Everyone has learned that keeping your vitamin C levels and your zinc levels help you fight infections. So you don't really need to go buy tablets and have that, but have nutritious food. And always cough etiquette and cough hygiene in our country is very poor. If we have to cough, we are going to take our mask off and then cough on somebody. So try and not do that. And maybe cough into your elbow, which you've learned throughout the year. Practice it, make it a way of life. And what India taught everybody, make it a way of your life. Namaste rather than shake hands.
And when I'm traveling, because I have to travel, or because I need to go out and meet my friends or play cricket, are there any additional measures that one needs to put in place?
Vikram, you want to take that?
Yes, thank you. So I would still suggest that travel should be avoided, especially as you see a surge of cases in parts of India and other parts of the world. As you can imagine, even though most airlines now have really good HEPA filters and have good filtration mechanisms, it's still a relatively enclosed space. Not just the airplane itself, but the waiting rooms, the security lines bring a lot of people. Masks, either an N95 or double masks, a face shield, bleach wipe your airline seats should be measures that you should take. Meeting with friends, we have known that, especially meeting with friends in bars and restaurants where people are shouting and screaming, is a very high risk super spreading event, aerosolization of infected particles. So we should avoid that as much as we can, especially till we have herd immunity and are vaccinated as a community. Playing cricket is good, keeps us all healthy, but if you have someone obviously sick in your team, and you should try to stay away from grouping together.
Absolutely. And would it be different if we were vaccinated?
I think we have a measure of comfort. We can talk about how with your colleagues and other people.
Sure. So I asked this question to you both only because we've been in this for 1 year. Everybody may not be as patient as the other. And two, everybody may not be in as comfortable a situation where they could continue to work from home and they may need to go out for the sake of business, for the sake of a variety of other things.